This presentation will provide an overview of antifungal medications. Fungal infections are often very difficult to treat and are a complicated area of therapy. This presentation will briefly cover some common agents and some of the risk factors of fungal infections, as well as common side effects of antifungal agents. Fungal cells are in many ways a lot like human cells. This makes them difficult to kill without also harming our own cells. The medications we use and how they target the death of fungal cells has potential to hurt us as well, as they may target components of our own human cells. Antifungal agents will target various areas of the fungal organism, and depending on where the medication targets and what the mechanism of action is, it determines the class of medication. This slide provides a few examples of different classes of medications as well as their mechanisms of action. Polyenes are a class of antifungals that are used to treat a wide range of infections. They can treat very common infections such as thrush and vaginal yeast infections to very severe infections. Nystatin is a medication that is used very commonly for oral thrush or yeast in the mouth. You simply swish the nystatin in the mouth, or it can be applied topically. Amphotericin B is administered intravenously. This medication has a lot of toxicity, and you have to manage the administration of the medication very carefully. It is often reserved for patients who are very sick. Amphotericin B is often called amphoterrible because of the bad side effects. The next class inhibits the sterol synthesis. Many of these you may have seen before as well. They are used for athlete's foot or tinea infections. An example is Lamisil or terbinafine. There are other examples of topical applications as well. The azole medications, such as fluconazole and itraconazole, can also be used for more serious infections. We often talk about how the ending of a medication can help indicate what kind of drug it is, but it's very important to note that not all drugs that end in azole are antifungal medications. For example, lansoprazole is used for heartburn, but it also ends in azole. Oral thrush is a common adverse event in patients using inhaled steroids, but this kind of infection can be easily prevented. If a patient is using an inhaled steroid, they should rinse their mouth or brush their teeth after using to avoid getting thrush. However, there are other reasons why people can get oral thrush that may be more difficult to treat or prevent. Nystatin is often used to treat thrush. In addition to inhaled steroids, patients can be put at a higher risk for getting oral thrush if they have a suppressed immune system or if they were on a broad spectrum antibiotic. It is best to prevent oral thrush, and it is usually easy to manage through topical treatment. Tinea infections cause three main kinds of infections: athlete's foot, jock itch, and ringworm, and they're all caused by different types of tinea. These are surface infections that primarily affect the skin. These are also usually pretty easy to treat, but it's important not to only use the topical medication, but to also care for the skin. Fungi love moist, dark areas, so it is important to make sure that the infected areas stay dry and clean. These infections are contagious and can be transmitted through many vectors. Tinea infections are also more common in patients with suppressed immune systems. They are also more common in damp places and places with lots of close contact, such as showers. To prevent these infections, it's important that you are changing your clothes, including socks and underwear, after physical or athletic activities, and that you aren't sharing any personal items. There are more serious infections known as opportunistic infections. These are infections that to most people will not cause any illness or disease, but to patients at risk, such as immunosuppressed patients, they can cause very serious infections. Fungal infections that get into the blood are very serious and are very hard to treat. Systemic fungal infections are worrisome because the treatment is often prolonged and the medications can be extremely toxic. The adverse events can vary from agent to agent, but there are many common adverse events for antifungal drugs, including gastrointestinal problems, a general malaise, or just kind of feeling bad and achy. There's also potential for liver problems and hypertension. Additionally, the adverse events are more severe with the intravenous formulations, with IV reactions including fever, chills, and dyspnea. Let's pause for self-assessment. Please take a moment to review and answer these 3 questions. Like usual, if you're having trouble answering these questions, please review your notes and the slides. In summary, fungal infections are often difficult to treat because the fungus cell shares many similarities with the human cell. However, if the infection is a surface infection, it's usually not that bad to treat, but we worry when we have to give an antifungal agent to treat a systemic infection.